All right, everyone. On today's podcast, we have Mr. Heber Miguel. He is the founder and CEO of Eber Health, based in Portland, Oregon. He is the son of two immigrants, and he is a first-generation college student in his family. And he does a lot to support and lead his own community there in Portland. He also manages a nonprofit that goes around doing different drives to help the homeless and the needy. So happy to have you, man. Thanks for stopping in.
Thanks a lot, Andrew. I'm happy to be here, and I've heard a lot of good things about your podcast, and I hope you're doing good in Florida as well.
Thanks. No, I appreciate it. Florida's good. Not as much rain right now as in Portland, I'm sure, but we just wait. Hurricane season's coming up, so
it's awesome.
Yeah,
I have the best memory I have of you, Andrew. I know we've known each other on and off. Is your hospitality when I think I was a junior in high school, and I went to American University where you were attending during your college years, and I don't think I knew you that well back then. I messaged you. I'm like, hey, I'm here for an extra day or an extra 2 days. Can I crash it with you? I don't know no one else in DC. And you're like, yeah. And then you introduced me to a lot of people. We played basketball, and I thought that was just the greatest thing. I think that's when I really connected with you, I believe.
Well, like we're talking, 3,000 miles, right? You're pretty far from home. And, you were still in high school, and, I wasn't quite done with my college career yet. So, it has a big impact, right? Seeing somebody that reminds you of home and your family and your friends, and it's special, man. So, dude, no problem at all.
Man.
I'm sure you crossed me over a few times on the court, so I'm sure I instantly regretted it. So, thanks.
No, thank you.
No, you got it, man. You got it. So yeah, no, I'm just really excited, man, because as we mentioned, you are the founder and CEO of Eber Health. And maybe that's a good place to start. Maybe you can just kind of tell us all what Eber Health is about, when you started it, what your mission is, and just go from there.
Sure thing. So yeah, I started about 2 years ago. It's a tech company. And the real reason why I started it was because, growing up, I used to watch my mother have difficulties accessing her doctors or wellness providers, just navigating the healthcare, the healthcare system, mainly due to her limited English, also due to the stigma that there's a big disconnect within our communities and healthcare. So growing up, I saw all this. Eventually, she was diagnosed with diabetes, and this continued going on and on. Next was my dad, which a few years back he was diagnosed with cancer. He was uninsured during the time, so after all the treatments came out, his whole life savings over the last 20 years, what he had worked, bam, disappeared. So I think those two events really helped shape my perspective on life, my perspective on healthcare, my perspective on business as well, because that's what I studied. And I found a purpose there. I found a way to help people that are less fortunate, like my family was, and bridge the gap with the bigger healthcare institutions.
Gotcha. And so because the very nature of healthcare and the cost of it in particular, and just the access in general, because it was such a struggle in your family, I think that's what probably attracted you to do something in that industry sector, right?
Correct. Not only me, but as well as my sisters. I have two younger sisters. One of them graduated as a registered nurse here in Portland as well. I'm sure that impacted her. She was always taking care of my dad when he was going through chemo and radiation therapy. And my younger sister, she's going through nursing school right now at Concordia. So, I don't think it's coincidence that we're all working in healthcare with the healthcare institutions. I think it's just the way life impacted us that we landed there.
Gotcha. And so when did Eber Health really become an idea for you? When did it happen?
So I was doing some studies in economics, mainly on how to, the healthcare spending is going out of control. So it really started with like a research paper, very basic. And I'm like, what's the best way to reduce costs? I saw that one of the solutions was moving away from a diagnostic treatment view perspective to more of a preventative view perspective. And I'm sure that's a lot That's what a lot of bigger institutions want to do, such as the Kaisers and Providence. But
Right.
since they're so big, it's going to take them a while to change their whole mindsets and frameworks and everything. So I thought perhaps a startup, would make it easier or faster, accelerate that transition.
So you start Eber Health, and you provide things like people can go to your website too, right? It's eberhealth.com.
Right.
You provide things like wellness checkups, nutrition, massage therapy, acupuncture, yoga, chiropractic services. You work with like 12 different providers, and these services, every single one of them, can be ordered from your phone to your doorstep. So explain that process and the concept of your mobile application.
Correct. So right now we're going heavy. We doubled down on our website, web platform, because a lot of our visits we're piloting with both the mobile applications and the web platform. We found that 80% of our visits were coming from website, and a startup has limited resources, a smaller team, so we decided to focus all our efforts right now on the web platform and grow that out, and then eventually introduce our version 2.0 in iOS and Android. So right now we're mainly focused on the website.
And I know it's not really an analogy that you seem to enjoy hearing, but it's one that I think people relate to most, and that's that Eber Health is really the Uber of the healthcare industry. And I know you don't like to hear that, but what's your first reaction when I say that?
I think it's funny. Yeah, we do get that a lot. The Uber, the name is a coincidence that the names are similar, this and that. I'm like, half of that is truth, because when we're beginning it, we're like, if it's Uber, Heber, they're gonna think of Uber, but with a doctor. If we put or a wellness provider, they'll be able to make that connection faster. That was our thought. Eventually, we started looking more into Uber, and we started seeing that we wanted to build our business a bit, take our business a different direction with regards to the connections.
Yeah.
And we also saw that it wasn't a grab the same model Uber has and do it on healthcare. It doesn't work that way. There's different regulations, there's different things you have to outlook, and there's different challenges you have to overcome. And therefore, after you overcome all those challenges, you have something totally different.
So let's talk about your platform. So,
Sure.
Very similar to Uber or Lyft, people don't actually work for Eber Health. They serve more in that contractor, basically like an individual contractor capacity. Is that the right way to say it?
That is, we're heavily towards what they call the new economy, the gig economy. They're all contracted people. And their main reasons why they're in the platform are two. One is to make an additional income aside from what they're doing. Two is to help people on their free time. So there's different motives in that sense as well.
So you go out to providers and, places like Kaiser and others, and you work with them to build your network and your base of clientele. And I guess the major reason for that is because you want to make sure that the people who use your application and order healthcare or wellness services are able to get reimbursed or they're covered through their insurer. Is that right?
For the most part, right now, it's half right. So we are initially we didn't want to work with the insurance companies. We thought they were like dinosaurs. We thought they were corrupt. Cheers to the insurance companies. We didn't want to work with them. Our whole reason why we started was to be an antidote to them, or to be an antithesis to them. But healthcare is so complicated once you get into it. Eventually, you have to work with them, at least at the beginning, because like you're saying, so many people are insured right now. There's a lot of people that are insured. I think it's almost more than 80% of the population, 90%. I'm not sure what the stats are, but they're always asking, hey, am I going to get reimbursed, or am I going to get a deductible, blah, blah, does my insurance cover this? So
right.
Initially we were reimbursing them through our platform, but now we're looking to partner up with these insurance companies such as the Kaisers,
right,
to be to cover the cost fully.
And since we're on that, here are a couple statistics. So these are from 2016.
Sure.
This was a survey that was done by the National Center for Healthcare. People under the age of 65, right? There are 28.2 million in this country who are uninsured. 28.2 under the age of 65. It's a hell of a lot of people. And in percentage terms, that's 10.4%. Think about that. 10.4% of the American population, quote unquote, the greatest country in the world and the most powerful and the wealthiest. We have 10% of our people under the age of 65 uninsured. That's a big problem. When you look at the children, everyone under the age of 18, that figure is 5% uninsured. Now that's just flat out unacceptable. 5%. And from like a GDP perspective, I found that's interesting. So the U.S. spends about 17.7% of their GDP on healthcare. The UK, about 9%. Canada, 11%. Germany, 11%. France, 11%.
Wow.
It's quite the contrast, man. Especially when you hear so much debate and so much ruckus about how the European healthcare system is more superior to the U.S. and the notion of universal healthcare and the single payer system is what we should be going after. It's just something's not right, And I feel like at least in these debates we get so hung up on what's wrong, we don't kind of take that next step towards that solution. While we're on the topic, I guess, where Eber Health is kind of positioned, you talked about this transition from diagnostic care to wellness. Explain the difference between the two. What's diagnostic care and what's wellness?
Sure. So diagnostic and preventative. Another way I like to describe it, as you said, diagnostic and treatment care versus wellness care. Pretty much means right now, if you get sick or if you break an arm or whatever it may be, you go to the doctors, right? That's usually the only time you go unless you go for your annual wellness check, which is really not a wellness check. It's just checking a few things. But in that sense, you're just going to a doctor when you feel sick. A preventative approach is not going to doctors when you're getting sick, but always keeping you healthy throughout the whole process. Throughout your whole life. That's more of a preventative approach instead of, for example, you find out that you have diabetes when it's already gone too late. This is called a preventable disease or a non-communicable disease. You can stop that from happening from, basic health education or pairing you up with a physician or a dietitian. You can prevent a lot of these illnesses that is impacting our medical costs, and
right.
And by shifting that mindset into more, hey, let's keep the people healthy from a young age, that's going to save us a lot, and that's pretty much what we want to accelerate that transition. I feel everyone knows that's where we need to go,
right?
But I feel, like I said, I call those big institutions dinosaurs. They're big. They like can barely move. And they have systems. Don't even get me started with their EHR, EMR, their electronic medical records. There is some of the most outdated technology software out there. And the reason that they haven't optimized it is because they're in contracts. So they're in 10-year contracts, 20-year contracts with companies, and that have no incentive to improve the product, so they can't go shopping around. So you see how slow they are, and that it's just so slow. So what we want to do is, we didn't want to be the only solution. We just wanted to get the ball rolling really fast, along with other people that are heading that direction. And hopefully we can either slay the dinosaurs or they can come join us. But either way,
artificially create an ice age and just, we know what happens. At least we think we know what happens. Dude, quick segue. It's amazing how much conspiracy theory there is on YouTube now. Like you just YouTube conspiracy theory, and you can find stuff about the moon landing and healthcare and all sorts of stuff. Anyways, podcast for another day.
Yeah. You should invite what's his name from Texas?
Oh, from Texas, who?
Never mind. Alex Jones.
Oh, Alex Jones. Yeah. Oh my goodness, Alex Jones. Every once in a while, he'll invite what's his name, Joe Rogan, on the show.
Oh, nice.
It's good. But you mentioned one thing about cost control, right? So one of the things we have to do better is be more effective and efficient with our costs. And so you mentioned one thing where, if you wait too long, if you have symptoms of a disease, let's say you have cancer, or maybe you do have diabetes or something like that, right? That requires, continuous treatment. And in many cases, the later you wait or the longer you wait, the worse it can get and the more expensive it is to treat, or even try to cure. So, one of the things that I think preventative care does is, address your long-term wellness and your long-term care. So I think we have gotten a little bit better. We'll have to talk technology before the end of the podcast. Everyone has the Fitbit. Everyone's wearing that fashionable tech that tracks their calories, their step count, their heart rate. And so everyone, little by little at least, is becoming more conscious about their health. It is fascinating how it's become fashionable to wear, electronic healthcare devices on your wrists. Kudos to MyBand and Fitbit and Apple Watch and all those guys. But cost control, I think, is huge. So I like the angle that Eber Health is taking, and focusing on those things that can add long-term value to someone's health. That's great. And I think developing an application that you can download on a smartphone, I think, a good example I've heard you talk about in the past is, let's say you're playing basketball at a gym and you twist up your ankle. Now, you can go to an urgent care, you can go to the emergency room, but we know that comes with a very, very high cost in this private insurer-based system we have in the country. Instead, you whip out your smartphone, pull up the Eber Health app, and as long as you're in the network, which I believe right now is in the Portland area. If you're within the Portland area, you can find somebody who can come attend to you and help you, wrap up the ankle and get better. So it's really on-demand healthcare. It's different than the virtual webcam services you often hear your employer talk about. This is somebody who actually goes to you, to your location. And that's why I think it's funny we talk about it as the Uber of healthcare, is because it's not just on demand, but it goes where you are. Can you talk, maybe about an example of somebody who's used your app in that sense?
Yeah. So an example was someone got injured at the basketball court. They didn't get injured fully like the example you gave, but they were having back pains after a game, and they didn't know what it was. So one of our doctors, his name is Dr. Daniel Roa, he's in our network, and he went to visit this individual. I can't give out his name just for privacy issues, but he checked him out, and at the end of the day, all he needed was some back painkillers, but a specific kind that you had to get prescribed. So Dr. Daniel Roa prescribed it to him. They through our network, we were able to shift it to a Walgreens, and then he had his girlfriend pick it up from Walgreens, and it's like that. Within an hour or so, everything was solved. That is painkillers.
And earlier you mentioned that 80% of the orders or the clientele come through the website right now.
Correct.
Is that what you would expect in the digital healthcare space right now? Is it more driven by the websites and not so much by the app right now?
For the most part, I believe so. Yeah, because the reason why we went the app route first was because you have all this cool technology such as like Uber, OfferUp, and you can go on and on. The reasons people use Uber and Lyft is because they're on the go, so that's their phone is the only thing they have. But when you're at home, you're sometimes using your phone, or other times the desktop, especially when you're making a purchase similar to this. I believe that played a lot into it. So that's why I think that's the optimal solution for right now. In addition, a lot of the clientele are coming from corporate employees, like that request massage therapy, etc., and they're on their computer as well. So that's why computer option we doubled down on.
And is your vision for Eber Health to be nationwide? And how do you kind of view that expansion out of Portland, Oregon right now?
That is our vision. Our vision. So this is what's happening with society as well. Aside from healthcare, there's rapid urbanization all over the U.S. and all over the world. Everyone's moving to the cities again, or not again, but they're moving to the cities. And by 2050, the cities are going to be one of the biggest communities, everywhere. Big cities, big cities, big cities are going to continue growing. So with this, you can connect pieces now. You can connect the pieces by, providing wellness care, going through to the home or through a lift, and make those connections based on the growth of population through the city. It makes it efficient. That makes sense.
I think the notion of telemedicine and remote monitoring and things that allow a physician or damn your apple, son. Damn your apple.
What?
I like.
Oh,
I'm not gonna cut this. This is fantastic. I'm not. By the way, if those of you watching or listening have noticed, I have quietly transitioned from wine to whiskey because I ran out of the vino, or as the rum, as Jack Sparrow would say. So I'm on the whiskey for the rest of the podcast. Okay. Anyways, so this whole notion of telemedicine, remote monitoring, we talked earlier about how, people use Fitbits and other wearable healthcare related technology devices to track their health and their well-being. Things like heart rate, calories, steps. What is technology doing to the healthcare industry in that sense?
With the Fitbits and tracking, it's making healthcare more accurate with data points. If you get enough data points, you can even predict when a person might fall down or get sick based on the different data sources. So when you get a lot of different data sources from an API, such as your Fitbit, such as whatever other application you're using, plus getting monitored via how many times you touch your screen on the phone, a lot of different algorithms can go into perspective, which can give you a better illustration on that person and on a personal level. Instead of saying, hey, you're 5'10", 180 pounds, this is what you need. No, we can precise it to every detail. And
so sorry to interrupt, but really quick question. So does that mean we're going towards a society where, my doctor has a real-time live feed of my heart rate, my calorie burn, I don't know, maybe my food intake and all that different stuff? Like, is that where we're heading? Where your local physician has like a live feed of your health? Correct.
Yep. That's where we want to head. That's where we're heading. That's where a lot of companies are putting their bets on. It's just a race right now. A lot of companies are heading that way. That's where we want to head. And then you can get into other issues later on, obviously. But this sense, you can optimize health by, you can precise it to the extent of making someone live past 100 just based on data points, changing their eating habits based on their intake and how that impacts based on their genetics. And you take a lot of different variables, and you can do some pretty cool stuff. I think I know a big company that's going that direction is IBM with the IBM Watson, and they've done pilots up in New York where check this out, where a lady had cancer, right? She was around her 40s, and they went to the physicians, all the physicians in New York around that area, the East Side area, and no one could find a cure for her. They gave her 4 years to live, I think, or something crazy like that. 4 months, I forgot. I'm gonna have to research. No one could hear. Then Watson, they tried Watson. Watson was able to research a lot of medical literature just because it's a freaking brain, a computer, and Watson found a solution for this woman. Found a solution on how to overcome cancer based on his different intake of data points, and it's just fascinating because a computer of Watson's capabilities, once optimized, can research everything in medical history, everything in medical literature, everything in medical review within 5 minutes, within a coffee. While the doctor's taking his coffee and drinking it, Watson would already know. A doctor, a doctor, it would take him maybe 1,000 years to read over all the literature that right now is at current. Watson can do it in 5 minutes.
So the computing power and all the algorithms condenses like 1,000 years of like real human interaction and thinking and
correct
problem solving into 5 minutes. That's insane.
Yes, it's super insane.
So then you I don't know about the story. This is the first I've heard of it. I'll have to go back and research it, but just because I'm curious. But so it actually helped this person overcome cancer, or at least find a treatment. Is that what happened?
It helped
that person survive.
It survived. The person survived.
Wow.
Yeah.
Wow. Send me the link for that.
I'll send you the link. Yeah. It's a peer-reviewed research paper, so it's not. Yeah. It's like doctors did studies on it.
Yeah.
And this computer is just getting smarter and smarter. So now take that in combination with the different APIs and data points that we started talking about, the Fitbits, and now you get a picture on, where healthcare is going, what our doctors going to be doing. Is their job going to change? Because doctors, remember, we started with diagnostic to preventive, diagnostic to wellness, treatment to wellness. And right now, the doctor's job a lot of the time is to diagnose what's wrong with the patient. And they diagnose it based on previous experience, based on their medical school, based on different research that has been done.
Right.
But if this computer can do it more efficiently, more effectively, and by the way, the computer, as it becomes more optimized, will be more and more accurate, which means less and less falls. While a doctor can't really make those type of improvements. It's humanly impossible, just because we're limited. So you take all that into consideration, and you get a glimpse on where people are going. Now you bring in augmented reality and virtual reality with the headsets, and now you get to see how it's shifting society. And then you talk about security, on how to keep patients' health records secret, and you get into blockchain technology and cryptocurrencies, perhaps, to protect. And it's just fascinating how, if I had the resources, you can tackle each of them. But it obviously, it takes different companies to do this. It's just so much that needs to be changed. But yeah.
So as we see this digital healthcare really take over the landscape, the typical brick and mortar, you go visit a doctor landscape, one of the things you called out was security, whether it's data security, web security, smartphone security, basically the integrity of being able to keep your information as a patient private. Just explain a few of the obstacles for you at Eber Health, what you guys have had to deal with in terms of HIPAA regulation, and I guess that subject in general.
Sure. So the healthcare industry, it's very, very regulated compared to other industries. You have the finance industry, which is also regulated, the oil industry, the agriculture industry, and bam, bam, bam. Healthcare is one of the most regulated industries. There's a lot of rules and regulations already set in stone. One of the big ones that you touched about is the security and privacy, and that is under HIPAA laws. And the main purpose of HIPAA laws created in '96 by Bill Clinton was to protect the data of each patient. You didn't want to sell that data from the patient to someone like a treatment company or whatever, and funnel that. It has to do a lot with ethics. There's also the kickback laws, where you cannot have a doctor recommend a certain product based on his position to a patient, because then, again, maybe that patient doesn't need that product, and now he's being towed around, perhaps, to buying this product. So a lot of those are set in regulation to protect people. But get this, Andrew, it was created in 1996. Bill Clinton, right? Did we have a mobile app in 1996? I don't believe so. Yeah, no one did. We were like kids, right? We were playing basketball.
Space Jam, man. 96. Probably Space Jam.
Space Jam, Jordan hitting those game winners.
That's right, dude.
Um, the Toy Story.
Toy Story. Oh my gosh.
I mean, that's what we were watching. We're going to Toys R Us, which got disrupted. Um, but yeah, anyways, so a lot of these rules were placed before the internet was in its full capacity. So we had what, AOL, like dial-up 96.
Oh man, I still remember that 56K modem, 28K modem.
Oh my, it was bad, huh?
Dude, it was bad. No, I mean, I see what you're saying. It's like, a lot of these laws about security and privacy of your patient data were written well before the emergence of the internet, right? The World Wide Web and the digitization of society, right, as we know it today. I would see that as one of the main obstacles that you would face at Eber Health when 80%, right, 80% of your revenue engagement with clients is online, web-based. Sure. How do you get around that? And is someone keeping an eye on you?
There are people keeping an eye on us, government institutions such as people that regulate HIPAA. But at the same time, we're using encrypted technology. I mean, with HIPAA, you just have to follow the rules, protect patients or people's data points. And sometimes it seems hard, but in reality, it's just a process. Talk to a HIPAA consultant and you can get that squared off. Encryption is one of the best ways to secure the data, any type of data. I think the next step for us would be implementing that blockchain. The blockchain, therefore, no one could obtain the data except if you develop a quantum computer.
So just for people listening or watching the feed, what exactly is blockchain?
Blockchain, it's mostly referred. I mean, people have heard of Bitcoin, I think by now, Litecoins, or any type of cryptocurrencies. Blockchain is the technology that these coins were built upon. For example, the whole reason why a Bitcoin is valuable is because of the blockchain technology that protects that identity of that coin. So that's pretty much what blockchain does. And
so blockchain is like a method of encryption.
It is, yes. Okay. And the basic terms, it's more. But yeah, just think of encryption.
Gotcha.
Encryption that's very hard to crack. That's not traceable, and that's what blockchain is. For the most part, yeah.
So then, being in the healthcare industry, it sounds like you've probably spoken to a HIPAA consultant or two about what's okay to do on your website and what's not okay, what information you can collect, and how you can store it or who you can disseminate it to. I mean, it sounds like you've been a part of all of that. That's probably one of the biggest challenges in your industry, and I guess you could even call it a barrier to entry for anyone else. Yeah, it's
a huge barrier of entry. I mean, if you want to, it's so bad. I mean, like, let's say you try to start in healthcare and you don't have your systems under HIPAA compliant, and someone does hack your system. That's bad news, because for each violation, each person, you can be fined up to $5,000.
Oh,
which just doesn't seem a lot if you have a few clients, but if you have 100,000, a million, can you imagine that?
That's a lot of money.
It's a lot of money, man. And then not only that, but you can also, for each person, go up to, I think, 2 years in prison. It's nothing if you have one client, but if you have thousands, millions, your career is done. And somehow, so all the viewers watching on there, healthcare is complicated, and I would advise that you do contact an attorney if you do want to get in the space.
And right now you own 100% of Eber Health, is that right?
That's confidential, Andrew. I can't disclose that information.
You are the majority owner of Eber Health.
I am the majority owner.
Oh, okay. All right. You are the majority owner. Right. That's good. But, at the same, on the same token, I guess, you would be much more liable, I think, if something were to go south.
Correct. Yeah. Not only that,
I don't know what your corporate structure is, LLC, S corp. I don't know what you are, but I don't know what you file as. But I don't know.
we're a C corp, and yes,
Okay.
I would take a lot of the responsibilities, not only for being the majority shareholder, but for
Yeah.
also running the company, and I'm guiding the company. So
Yeah.
those
No,
are very
it is a serious topic, and I know that you do take it seriously. And I know that a lot of these Silicon Valley folks or grant issuing people here in or there in Portland, Oregon, wouldn't be offering you funds or awards to grow your business if you were taking it easy on one of the most important pillars of the healthcare industry, which is that security and safekeeping of patient data. So
correct.
that's pretty cool.
Yeah, and
Well,
not only
yeah.
that, but we're actually partnered with a company down in Silicon Valley that their whole mission is to protect those data. So we use them as a resource internally to safeguard the protection of each patient's identity and each patient's data point.
Well, that's
So
awesome. So you actually
so
have somebody who can kind of help you kind of
yep,
carry the burden. That's cool.
yep, and they've been in business since 2007,
Hmm.
and they're well known. So yeah, we kind of delegate that to them, just again because they have the experience and we're still young. Eventually, we do want to get our own internal systems in place, but at this point, for due to our circumstances, limited funds, a small team, startup, we delegate that to an outside party.
One of the things we talked about at the start of this podcast was how we spend so much time in furious debates just talking about the problems and what's wrong with the U.S. healthcare system. We don't do a good enough job of talking about the solutions and how we can work together to make it better. It seems to be a discussion at every presidential election. And, at two extremes, it's either we go fully private, fully public. It's just one of the two extremes. We can never agree on which way. Even when we think we do, we have a change in president and we seem to be heading in a different direction. I'm not saying one's right. I'm not saying one's wrong. I'm just saying we can't agree on solutions. And one term you hear an awful lot is this notion of the single payer system. So to me, in layman's terms, right, in simple terms, it means there is one payer of your healthcare expenses, right? And that's the U.S. government. The U.S. government collects taxes and pays your healthcare expenses, whether you're a citizen or resident of the country, right? So
Correct.
we look to places like Canada, right? Canada, I think, you could argue is a decent example of a single payer system with some exceptions. I would argue that it is universal healthcare, right? Universal healthcare in the sense that everyone is afforded access to healthcare, right?
Sure.
Not just folks who are over the age of 65, not just folks who are living with a disability. If you're a resident, if you're a citizen, you have access to healthcare, right? Universal healthcare. But in Canada, right, the government will not pay for your prescription drugs, for your glasses, for your dental work. For those things, people in Canada typically go for supplemental insurance so they can cover that kind of stuff, right? So again, single payer, the U.S. government is paying for everything. Universal healthcare is everyone has access to healthcare. At what standard or what baseline of healthcare? Obviously, it's probably different by country. I think in Germany and Japan, for instance, you have the option to sign up across an array of different plans. I think Japan has a ton of plans. I saw a figure that it was something like, I don't know, like 300 different plans. Like 300? 3,000. I think it was like 3,000. You can choose among 3,000 different plans in Japan. And Germany, I think it's closer to 300. But anyways, the point here is that, when we think about the terms single payer healthcare and universal healthcare, it changes by country.
Sure.
And it's very specific to whichever kind of regime you're talking about. But what do you think is the right system for the U.S. and what can we do? What can Eber Health do to kind of move us in that right direction?
Sure. I feel like the ideal system for the United States and for the world would be a system where none of its citizens ever get sick. I mean, that's the ideal, and an idealist would agree. A place where no one gets sick. Obviously, is that feasible right now? No, we don't have the technology, or maybe the funds, or perhaps we do, or governments don't want to. Regardless, I do feel technology will play a pivotal role as we go on to 2050s, 2100. Technology will play a pivotal role to ensure that the population stays healthy. And we would be able to do that in a very efficient, accurate, and affordable way. Now the question I think should revolve around what happens if everyone's super healthy. What happens? And an example that you brought up is Japan. Did you know Japan in, I think, the 1990s, 80s, they perfected the social welfare system. They perfected the healthcare system. And
what do you mean by that?
They got a population where everyone was living past 80 years old. No one was dying. Can you imagine no one dying for a long time?
Well, so are those the steps they've taken on the preventative healthcare side and the well-being side?
They were just protecting the well-being of their citizens, right? Everyone got the treatment they needed. The government was playing a pivotal role. But guess what happened? What happened was that there weren't enough young people to cover the costs. Everyone was living. There was a elderly population that boomed, and everyone was not dying, so they were on healthcare, blah blah blah, kind of like a Medicare system. And who was paying for that? Taxes. Obviously, it comes from taxes, and there weren't enough young people to support that. So
the amount of like procreation and the average family size probably shrunk considerably. Probably hurting that tax funding, right?
Correct. Yeah.
That tax collection.
Then you have a problem. So I bring this up so we could consider both aspects of, when a system is perfected, then what happens? Because eventually I feel that everyone wants, access to healthcare, access to great healthcare. I don't think a person would be like, hey, I have great healthcare, so you can't have any. I don't see that happening unless it seems very inhumane. I think as human beings, we want to perfect that healthcare system, but at the same time, as we're painted a utopia, which is many years ago, many years from now, maybe centuries. So we have to balance the economics, as to the example of Japan, and we have to merge it with the technology so we can eventually get to that system.
Well, I think you have, this raging, debate of, how do you solve the social injustice, right? Of not everybody having access or affordability to healthcare, right? It's a social injustice when you talk to a lot of people. But it's also a discussion of economics and how do you make it affordable, whether it is, a single payer paid by the U.S. government system, or slightly subsidized, quasi-private insured pay system. There's that social piece, there's the economic piece. One of the things I've heard is from people who might even agree that we should go to a single payer system. We should let the U.S. government, via taxes and things like that, pay for our healthcare. One of the biggest obstacles is we've already perhaps allowed the cost of healthcare, the cost of prescription drugs, the cost of physician visits to go so high that if we were to turn over control back to the U.S. government, it would be so hard to negotiate those prices all the way back down to a baseline or to a standard that would be, that would be affordable, right? We'd see hospitals going out of business, medical clinics going out of business, doctors losing their jobs. I think by having the price of, again, prescription drugs, physicians, hospital visits, by having all this so expensive and the cost rise so far up, it's going to be very hard to tackle that. It's one of the biggest arguments I've heard, even from people who think that we should be going to that single payer system. Do you view, let's just take the example of prescription drugs.
Sure.
Do you view the price of prescription drugs as one of the biggest obstacles out there?
It is. I mean, I heard a statistic where the average American takes anywhere from 6 to 12 prescription per year. And it's just insane, and the prices, if you look at the statistics, have also been growing at a rapid rate similar to that of the education, student loan, et cetera, schooling, universities. So that is a huge obstacle, mainly because, with all honesty, and based on the feedback from the providers in our network, a lot of those stuff could be solved just by eating healthy, by a lot of those nutrients that you get in those prescriptions are already in our foods. We're just not consuming it in a, or what happens is we actually don't consume it in a proportional rate. Eventually we get sick, and now we have to compensate the sickness with this supplements or prescriptions. But in reality, yeah, it's a huge obstacle, man.
So you're saying one of the ways of actually dealing with that, one of the solutions is, again, going back to that nutritional aspect of your life, talking about what you're taking into your body, what you're processing, what you're eating, what you're drinking, and getting much more out of that than you were otherwise. No, I think it's a good point. I think, especially if you can get that from a natural substance and not from a prescription drug or some pill that you take from a bottle, that's great. That's fantastic. It's obviously a very, very huge obstacle, and the whole, opioid epidemic is outrageous. There have been a lot of documentaries and discussions about that for sure. That's a big problem in this country. But big pharma, man, with all the lobbyists and it's a tough obstacle, man.
It's a very tough obstacle, similar to that of the tobacco industry. I think a lot of people know that smoking is bad, but why do we still have it? It's special interest groups.
You, my friend, don't drink alcohol. You don't smoke cigars or cigarettes. You have very few vices, my friend. Here I am drinking wine and whiskey. Literally.
Oh, you were lying.
I was not. Dude, have you seen these podcasts?
No, yeah, I have. A little bit.
There's a really good Forbes article out there. I think it was published just 3 or 4 days ago here in April. And they talk about this digitization of the healthcare industry. And they talk about how the digital healthcare industry has gone from $180 billion and it's on its way to, 600 or close to 600 billion by 2025. And it's clear that there's something in the works. I think you're already one of those kind of early adopters and early innovators in that space. You've been with Eber Health for some time now, and you've already locked in a nice set of providers, and you've gotten your network of massage therapists and nurses and things like that. So you've even gotten partners down in Silicon Valley to address your security concerns and privacy of patient information. So you're well on your way, I think, to protecting your slice of that pie, of that almost $600 billion pie by 2025. So, which is pretty cool, man.
It's a very, a big, a lot of changes are going to come. Like you said, digital health. I think everything you can think of healthcare as being trying to be disrupted. For example, anything from scheduling, like within nurse scheduling. There's a company here in Portland as well called NurseGrid, and they're helping nurses with scheduling, with scheduling software and applications. There's another company here in Portland as well called Bride MD, which what they're doing is...
You said Bride MD?
Bride, like bride.
Like Here Comes the Bride?
No, Bride.
Oh, Bright. My bad.
Yeah, Bride. Yeah, Bride MD, and what they're doing is... Are you okay, Andrew? Andrew,
sorry,
do you want to pause?
I'm sorry. I just thought Bride MD. Why would the bride? Why would I go see the bride? I don't know. But they're around to help solve the scheduling issues. There he is with his apple again. Damn you.
And an apple a day keeps the doctor away.
It's true. But an apple a day also keeps them off their Eber Health app. So,
Whatever keeps the people healthy, that's my concern.
There you go. All right. Well, before we wrap up, man, I think it's important because we started off this podcast talking about your sort of entrepreneurial career, Eber Health, founder and CEO, but how you also had this really fascinating kind of family history. Your father went through cancer, right? Your mother and your father both had difficult issues accessing affordable health care. And, your own sister went into the medical field as a nurse. It seems like this whole industry has had a very profound impact on your whole family. One of the things I wanted to spotlight was your involvement with IBEA, an organization called IBEA, which is a nonprofit organization based out of Portland, Oregon. Let's spend a few minutes just kind of talking about that. Why don't you tell us what IBEA is? Sure.
IBEA is like you mentioned, a nonprofit here in Portland. It was started while I was in college with a couple of my peers. We just wanted to do good things for the community. I mean, I think when we started, it really started with a vision and concept of innovating for a better world, for a global purpose, innovating for everyone around the world. And I feel like I've connected with a lot of my members from previous years, and everyone still has that same outlook, kind of like, what can I do for my community to make it better? One of the first projects we took on was helping the homeless community here in Portland, which is getting bigger and bigger concern. It's a big problem in Portland. Obviously, we were young at that time. We were still in our early 20s, college students, and we didn't know much about business or how to launch projects, etc. But we did have a passion. We were walking and we saw homeless people out in cold during the winter.
Right.
They had like no socks, no blankets, and they were just laying there, sleeping. And I think that really touched us profoundly. And we're like, well, what's the least we can do? What's the most we can do? What can we do at all? And we're like, well, let's provide blankets. Our first project was a blanket drive for the homeless, and we were low on funds. I think the first project we only had like $300 that we collected from donations. We bought some blankets. We bought some ponchos for the rain as well, and we bought some hot chocolate. And we went around on a Saturday just to talk to them. They were really good people. They just were in a very unfortunate situation. With that, we saw that we wanted to help them more, but we had a challenge. We didn't have funds, and no one was going to fund us because obviously we were young. We didn't have the experience, the expertise at that point. So we're like, how can we fund these projects? And we reached out to some colleagues at Intel. There was a lady by the name of Suzanne. She actually goes to Florida a lot. She's a huge USF fan, University of South Florida.
It probably exists. I don't know. I'm so bad with the universities and colleges out here. Yeah.
Yeah, she goes there she takes all of winter and flies there every weekend because she works at Intel here.
Every weekend.
She's a big #1 fan, I would say. But anyways, she started by donating her time teaching classes on Agile and Scrum and Kanban, things that we didn't really get to learn in college, and we'd charge students $25 to attend the class, and professionals $100, and that's how we started raising money. Then we would use that to fund the projects. And
all right, so let me get this straight. So you collect funds, right, by providing technology-based, software-based seminars to students and professionals. And with a portion of those funds, you go back out into your own community there in Portland and do the blanket drives and the poncho drives and the hot chocolate drives. That's amazing.
Yeah, it's
amazing.
Small project, but
because everyone knows that you can go to organizations and just donate money that are intended to, go serve, homeless or people in need. But, I'm sure there are organizations that do what you do, but it's pretty cool to hear about it, that you offer a service, right? Which is, I'm a student who wants to learn more about Agile or that Scrum process, or product development process, and I can go to your seminar, spend an entire day learning about this, and know that a portion of that contribution is going to help somebody who doesn't have a roof over their head that night. That's pretty incredible, man. That's amazing. It's amazing. I think, if at least for me, from my perspective, it goes back to kind of your own humble beginnings and how your parents were immigrants and they came to this country with nothing, right? Because I know you so personally, man. I know how hard of a worker you are, and the work ethic that you get from your parents. And, I know that it means a lot to you to be able to go back and contribute to your own community and be a leader in your own community there in Portland. You should take a lot of pride in that, man, especially at such an early age. You're still in your 20s. It's pretty incredible that you can be a part of such innovation and cultural change. That, you go off to start your own nonprofit called IBEA. It's pretty remarkable, man. If you had to say, let's say over the next 5 years, where's IBEA in 5 years?
IBEA in 5 years, we would like to scale our model to other cities. We have a colleague down in San Francisco, as well working for Intel, spread down there and spread as well in Seattle. The cool thing about it is that we've been doing this for about 3 years now. Or a little bit over 3 years. So we had a few speakers. Suzanne was the main one, but now she's attracted more people, and there's more people that need these types of certifications, and there's more people that want to teach. Because when they teach, they get, you might know this, they get not a higher certification, but it counts more when they're looking for jobs. So they're looking on ways to see. You see the connections now,
right?
So now they're contacting me. I had a guy contacting me last week saying, "Hey, I want to teach. I need to teach. I need to get so many hours. I'm doing it for volunteer. That's fine. I just need to get those hours to teach so I could practice because it's required through their certification funnel."
Right.
And I'm like, sure. And then I got another one the week before. So little by little, you're getting these professionals that are willing to teach. Most of them have been to the class. That's how we get connected in the first place. So now it's becoming a bit more effortless as opposed to the very first months where we're like, what are we doing? How do we throw an event? How do we get the people to come? Is it too expensive? Is it a good experience? Well, it's now an autopilot. So
yeah, no, that's great. It serves so many different purposes, and this is altogether separate from Eber Health, right?
Correct. Yes.
That's awesome, man. No, I wish you the best of luck, man. I really appreciate you kind of stopping into the podcast and giving your thoughts about the healthcare industry, where it is now, where it's heading, what technology is doing to kind of disrupt or lead it into a new direction, hopefully a better direction. And again, really appreciate your work with IBEA. Keep doing that. I think it's easy to go into a business as for-profit. Much different, I think, to go into an organization that's committed to helping others and being a public good.